Okay, well, welcome everybody to the third webinar, asbestos webinar. The asbestos webinar is spearheaded by Alec Farquhar, and we've been working behind the scenes to pull this together. And there's Lydia Renton, who is on our international board. It takes a village, which it certainly does. We've had about, well, this webinar, there will have been about 30 international speakers. And the last webinar we did a count, there was about 60 countries represented. So this webinar, it's evaluating risk and preventing asbestos exposure challenges, tools and resources. You'll find this webinar a little bit more technical. And I guess the message that I want to send out before I present the introduction is that it's so important to understand the exposures. If you think about risk management, hazard identification is so important. So it's really about understanding what the exposures are before, doing the assessment and then the control. And I just want to start off with a land acknowledgement. I would like to begin by acknowledging that I am speaking from Ottawa, Canada, to all First Nations, Inuit and Métis people and their valuable past and present contributions to this land. As I am in Ottawa, I'm located on the unceded territory of the Anishinaabe Algonquin Nation. I just always want to like to put up the strategic framework. We did expand the strategic framework to include families and communities. We really want to prevent work-related disease. We want to share expertise, knowledge and skills, especially to underserved populations around the world. We're a volunteer organisation. I just want to, and I know Alec's going to talk more about this later on. Antoine Nguyen, who's the president of the US branch, is really trying to organise a conference in Vietnam. So we're really looking for donations to help pull this conference together. We're, like I said, we're all volunteers, so there's no charge for this webinar. There are maintenance points offered. So if any of you have access to maybe multinational companies and donations, please reach out. This is the third webinar. The first two webinars are now on our YouTube channel, and you can also see the slides from the presenters on our YouTube channel as well. This webinar, like I said, it's a bit more technical, and this is the lineup. So I won't go through them yet. I'll go through them after a quick presentation. I just want to make you aware that it's actually quite a complicated process when you measure airborne asbestos fibers. And this is just a schematic. It's quite an old schematic from the late Dr. Dave Verma and Clark, Nancy Clark. It looks at the relationship between phase contrast microscopy and transmission electron microscopy. So if you see the schematic on the left, you'll see PCM. That's actually phase contrast microscopy. So that's using an optical microscope to count fibers. But then when you look at electron microscopy, you see so many more fibers because of the much better resolution. And then the schematic on the right there, or the graph on the right, you see that once you get below 0.01 or 0.01 fibers per mil or fibers per cc, you're really below the limit of detection for the method. So it's an old method. I just wanted to highlight that. And I guess if you think about chrysotile, this is just a paper from that's talking about assessment of occupational exposure to asbestos fibers. It actually talks about chrysotile can generate fibrils with diameters down to 0.02 microns, which is really beyond the resolution of an optical microscope. And I just pulled this from a paper as well by Eipert, Blason et al. 2017. The use of transmission electron microscope-based methods with this assessment of all airborne fibers will allow a more consistent measure of exposure and risk across fiber types, industries and operations where the proportion of fibers included in regulatory assessments is highly variable. There's just also another paper, I won't go through it, but there's work being done to look at the risk assessment using electron microscopy. And what's kind of striking when you look at these levels of risk, it's really saying that we need to go well below 0.1 fiber per mil to really, get more of an acceptable risk. The limit of 0.1 fiber per mil, it's quite old. The ACDIH published it back in 1998. Offerman's is a more updated risk assessment, which talks about with a finished job exposure matrix of 0.2 fibers per year per mil exposure estimate with hazard ratios of 2.69 and 1.47 respectively, and that's for mesothelioma and lung cancer. But probably the jurisdiction that seems to be the most advanced is the Netherlands, and they've actually reduced their limit from 0.01 fibers per mil down to 0.002 fibers per mil. And this purpose of the standard was to limit work exposed to asbestos to prevent lung cancer and or mesothelioma. The European Chemicals Agency have this scientific report, and if you have a look at the column on the left there, DECOS, which is the Netherlands chrysotile, they've set the exposure limit for chrysotile at 0.002, but that applies based on actually transmission electron microscopy. But they do say that there's an assumption that TEM will detect 2 times more fibers than PCM. So in recent French analysis, samples asbestos removal work sites when restricting the counting to fibers that conform to World Health Organization definition, excluding short fibers and thin fibers not detected with PCM. The arithmetic mean TEM to PCM ratio is 4.6. So when combining all asbestos fibers and material types, it ranged from 0.1 to 19, depending on the type of asbestos material removed. When including all fiber widths, also thin asbestos fibers not detected with PCM, the arithmetic mean was 15 and ranged by type of material from 0.2 to 95. So I guess the bottom line is there's no consistent ratio between TM and PCM. And so the latest, the Committee for Risk Assessment opinion on scientific evaluation of occupational limits for asbestos talks about considering that also thinner fibers are carcinogenic. The Risk Assessment Committee is of the opinion these fibers should be considered when measuring exposure in the workplace. However, harmonization work is required at the EU level, covering the dimensional fiber definitions, counting rules, and other factors that influence the electron microscopy asbestos fiber counts. So that's just the limitations with regard to the methodology. And T's going to talk a bit more about, elongate fibrous minerals. I just want to make everyone aware that erionite is a concern as well. It's not the classic commercial term asbestos, but erionite has quite high potency, and Dr. Andrei Korchesky will touch on that as well. So basically, I want to introduce Dr. T. Giuditti. He's a physician trained in occupational and environmental medicine and pulmonary medicine. He's lectured frequently on asbestos and asbestos-related diseases. He's the past president of the American College of Occupational Environmental Medicine. He went to medical school at the University of California at San Diego, then trained in medicine, pulmonary medicine and occupational environmental medicine, and got his MPH at Johns Hopkins. He trained in research at the National Institutes of Health. He has served on the faculty of the University of Alberta and the George Washington University in both medicine and public health, and was a Fulbright visiting professor at the University of Alberta at the University of Ottawa. This really doesn't do Dr. Giuditti justice. really has great insight. He's an occupational physician, so this is a great example where, you know, medical doctors, occupational physicians can interface with occupational hygienists, and we work together. So I think what I might do is just might hand you over to T, and then I'll introduce each of the speakers before they speak. I think that's probably the best way to manage the time now. So over to you, T.
Thank you so much, Kevin. I think that a webinar like this actually, to me, highlights my limitations because I am not an expert on exposure assessment. However, I've learned basically what I need to know when faced with situations like this, and particularly with regard to a health risk assessment. Um, my message today, though, is going to be relatively simple, and that is that asbestos is not one thing, and that because it is not one thing, and it's not even the thing that we think it is, um, we often encounter problems with regulations that are appropriate. The case of Area Unite in particular. So I'm going to, I'm pleased to be the first one to begin, but I just warn you that this is not an exposure driven talk. This is contextual about what we are doing when we talk about exposure. So this is a quick overview by about what we are talking about when we talk about asbestos. Uh, Let me just fill you in on a little bit of history on what we how we determined the diagnosis of asbestos-related disease from a medical point of view. And that's that it was essentially an individual diagnosis until 1980, when when the College of American Pathologists um, first developed histological criteria based on tissue inspection by microscopy in 1980. So that was the beginning of sort of a standardized notion of what asbestos-related disease was, and it came relatively late, and it was driven by the pathologists. And that's been sort of consistent throughout the history of asbestos, that clinical criteria and pathological criteria don't necessarily correlate well, and the diagnosis has been driven by the pathologists. Then there was a American Thoracic Society criteria developed for clinical diagnosis that came along in 1986, and that was largely superseded by the Helsinki criteria from the Finnish Institute of Occupational Health in 1997. And in 2001, the ATS revisited it and substantially changed the criteria in use predominantly in North America for non-malignant outcomes. And I chaired that committee. So I got quite deeply into the issue at that time. And that was published in 2004. And the mandate there was to develop criteria for clinical diagnoses as opposed to pathology, which was what the Helsinki criteria concentrated on. These are the Helsinki criteria, which have since been updated and are now the standard for the medical evaluation of asbestos-related disease. Now, when we say asbestos-related disease, however, that leads us into a regulatory problem, because asbestos is actually commercially defined. In other words, yes, it is a heterogeneous group of hydrated magnesium silicate minerals, sure, but the exactly what, but there are many of those, and exactly what constitutes asbestos is actually quite arbitrary. Um, the National Research Council, for example, which more or less controls the application in the United States, calls it a commercial industrial term. rather than a mineralogical term. It refers to fibers of this particular class of silicate minerals uh, that satisfy particular industrial needs. So when we talk about the six minerals that we uh, usually refer to as asbestos, we're really talking about a business and a commercial classification. The uses of asbestos, of course, are diminishing quite a bit. There are really only four major ones that we're seeing in North America these days, um, but we have a legacy, particularly with cement pipe installation throughout the world, that continues to create opportunities for worker exposure. In the United States, specifically, chloralkali electrolysis for the production of chlorine is the major use uh, that remains. That has a variety of other problems, including mercury release, but it's the major uh, residual use of asbestos in North America, and cement pipe in the rest of the world. Now, what defines what is asbestos and what isn't? Well, asbestos is an imprecise term. It always means fibers. There are different mineralogical forms of these magnesium silicates, and they do not conform to any mineralogical classification, strictly defined by history and convention. There are about 70 fibrous silicates. This didn't present much of a problem when the use of asbestos was well defined commercially and was a major industry. But since then, we have a number of situations in which non-asbestos asbestiform or asbestos-like fibrosilicates have become a problem, and most of those have to do with erionite. Erionite is found uh, in nature as a result of weathered rock formations and in drilling or digging through erionite layers. Uh, and it's famous, of course, in Anatolia for the environmental risk in communities in the ancient area of Cappadocia. However, erionite is also used as a catalyst. So interestingly enough, it has commercial applications, just not the ones that we normally think of. Oh, let me just, yeah. Um, the primary problem in North America was chrysotile. The primary problem in the rest of the world these days tends to be shifting toward the amphiboles, which continue to be used in cement pipe. Now, the reason for this fluidity in definition is that these minerals are actually on a continuum. They're on a continuum in terms of elemental composition. So if you're familiar with geoscience, these are uh, composition diagrams that are commonly used to illustrate families of minerals, and they're also on a continuum in terms of size and shape. And it's the small fibers, it's the smallest fibers that cause the cancer risk. Larger fibers may be related, we're not sure, disproportionately in non-malignant effects such as asbestosis. Serpentine asbestos has only one member of that particular category, but it has a particular property because it is essentially a rolled sheet as opposed to a solid fiber. It frays and fractures very easily. Um, so you get numerous small fibrils of varying length and much smaller than the original long um, rope-like uh, fiber that defines the class. Then there are a whole variety of solid fibers that we call amphiboles. Colloquially, we call them white, blue, brown asbestos, and others that don't have colors associated with them, but they all exist on this continuum of magnesium silicate materials. And there are big differences between them. So even though they are colloquially called asbestos, they have quite different properties. Famously, chrysotile is much more soluble in tissue, and that was used for years as an excuse to give a lower allowable exposure level for that, on the theory that they disappeared quickly. Well, they don't disappear that quickly. So that was a physical phenomenon was vastly overstated and held back effective regulation for some time. You see here the characteristic uh, rope-like form of chrysotile and how easily it fractures. Quebec was the major source of chrysotile asbestos, but mining there was discontinued in 2011, and so Canada has essentially been spared the shame of being the world's major chrysotile exporter, which it was for many years. Amphibole continues to be used, and one particular form of amphibole, tremolite, is a transitional mineral to a number of other related uh, silicates. In particular, one called the Libby mineral. The Libby mineral that was mined in Libby, Montana. It is a form uh, tremolite in a transition to a kind of club-like altered form of tremolite that is commonly that's a contaminant of other minerals that were exportable. There are many other uh, fibrous silicates, however, that are not counted as asbestos that we see from time to time in occupational health. The main one is fibrous erionite, which is not common, but it is remarkable because it sometimes appears on the surface in surface deposits that and can be released with weathering, with roads, and it's also used in the petroleum industry as a catalytic compound. Sometimes it's encountered in tunneling, and the last time I had anything to do with erionite as a practical matter had to do with its presence in a stratum that involved tunneling for a storage facility for nuclear waste. The erionite exposure has all the characteristics of classic asbestos exposure, both malignancy risk and uh, non-malignant outcomes, but it's not counted. And because it's not counted, it doesn't get the same regulatory attention that these others do, or health risk assessment attention. There's also a bit of shoulder shrugging on the grounds that because it's found in nature, it can't be effectively regulated. Well, it can be found in nature, sure, but um, human beings are still disturbing the ground in which it lies, as doing activities that release it into the breathing zone and expose workers. So I'm not sure that's a good argument for neglecting it. There's also another form of fibrous silicate that is relatively common, and that's fibrous mordanite. It is primarily a risk to be encountered in tunneling and in construction work. The Libby amphibole that we mentioned earlier is similar to tremolite, but it's pleomorphic. You can actually have transition fibers where one end of the fiber is classic tremolite and the other end of the fiber is sort of an amorphous club-like uh, configuration of silicate that is a little different. It's found as a contaminant of vermiculite. I forgot the word earlier when I was talking about Libby, Montana. And vermiculite was shipped all over North America. So it is a problem not only in the town of Libby, which is in Montana, but in places where it was received, processed, and distributed, in particularly railroad sites, because of its mode of transportation. Studies that compare carcinogenicity suggest that Libby-amphibole is easily as potent a carcinogen as crucidolite. So although these are not classic asbestos, they have the same health risk profile. I mentioned earlier that Libby-amphibole is pleomorphic, so you can look at a fiber that has different characteristics along its entire length. Well, that's also true with chemical composition. Within a single fiber, you can have different mineralogical characteristics. These names are really meaningful to the mineralogists as opposed to us, but it points out that these are distinct chemical entities, and asbestos is not just one thing. However, one thing that is meaningful, and that is its cancer risk. So I would ask, how is this meaningfully not asbestos in terms of regulation and health risk? My feeling is that if it looks like a duck, quacks like a duck, swims like a duck, and belongs to the avian family Anatidae, it doesn't matter what his color his feathers are. Let's call it a duck and regulate it as a duck, and not mess around. Just consider it asbestos and regulate it accordingly. However, the regulatory agencies have been reluctant to do that, and we've had a lot of back and forth about whether or not these minerals are suitable to regulation, based on what I consider to be trivial differences. I'm going to stop here. This was, I hope I've perhaps introduced a bit of skepticism in terms of what is and what is not asbestos. And it's up to you folks to tell me how to measure it and how to assess the exposure. Thank you very much.
Thank you very much, Dr. T. Giuditti. As always, we really appreciate your insight and knowledge and experience. And I just quickly want to welcome Neil McMillan too. I see he's from the International Firefighters Association. He's also been present in our last couple of webinars. So hi, Neil, thanks for joining. Now I just want to take you to the next speaker. It's Jason Hodgkiss from UK. Jason is part of Workplace Health Without Borders UK, and he's going to be talking about asbestos risk assessment based on material and situation to give priority. So Jason is postgraduated. He has a postgraduate diploma in occupational hygiene from Manchester University. He's a chartered scientist, a chartered environmentalist, and a CENV assessor, currently on the British Occupational Hygiene Society International Engagement Group, a trustee of the UK branch of Workplace Health Without Borders, and honourable treasurer on the BOHS board. And something that I didn't realise, he's also on the asbestos working group that Alec Farquhar is spearheading. But many years ago, Jason actually did work as a firefighter, so it's kind of interesting. So I'll now hand you over to Jason. Thanks, Jason.
Thank you. Thanks for joining us this morning. I'm going to do a whistle-stop tour of this, really. I'm not going to go through any examples, but just how we assess in the UK. There will be some links at the end, which I'm hoping you'll be able to download if you need to. So obviously, first of all, we find where the asbestos is, and then sort of need to prioritise how we work with whatever we found in the asbestos-containing materials, because we have not got an infinite pot of money to deal with. Everybody has to have budgetary constraints, so they have to sort of prioritise what they deal with first. So we have a material risk assessment that's in this surveyor's guide, or the survey guide, asbestos survey guide. Then a priority risk priority assessment based on its where it is and its situation, and that's in another document, which is the managing asbestos in premises guide. That'll give you a total score. Based on what Dr. T was saying, it's a sort of on our material types. We've got more hazardous to less hazardous, not only in what asbestos fibre it contains, but also in how sort of friable it is. So you can see here sort of loose packing materials, typically 100% asbestos, and it's typically, you know, one of the amphibols rather than the chrysotile, rather than the serpentine. But again, as we're saying, the serpentine is not not dangerous. Again, this is sort of UK based, so we're used to finding materials either in sort of certain situations, and it can be in poor condition. But we've spoken on the previous webinars where actual cement products in South Africa and India are actually being crushed down to its constituent part again, to be reconstituted. So the material types, as in the HSG 264, which is a survey guide, it gives you the product type, the condition that product's in, surface treatment, and then the asbestos type, which fibre is in there. Then we prioritise with a situation, so it's what the occupancy is, likelihood for disturbance, potential for human exposure, and maintenance activities, and they will give you a combined score out of 24. Again, there's no, in the UK legislation, it doesn't define which level requires being attended to first, but it does allow you to sort of prioritise your risks. So the materials assessment, this is fairly simple. It's just 4 categories, each one scored 1 to 3, and then at the end of the scorings, you've got those 4 things, times them up, and it gives you a score out of 12. So first one's got thermal insulation. That graph we showed you earlier, thermal insulation, the loose insulation, so on scores 3. Special insulating board, mill boards, again, things that are reasonably friable or can reasonably release their fibres easily, score 2. Asbestos cement, quite robust, and then texture coatings for vinyl floor tiles, etc., score a 1. Surface treatment, this is sort of fairly subjective, so you get some variation between people who are doing the assessments, but again, it's sort of unsealed insulation that's falling off of pipework gets a 3, and then the composite plastic materials gets a 0. Damage and deterioration, again, another subjective one, is whether there's whether there's breakages, any sort of delamination of insulating board, for instance, or whether it's just small surface scratches, and that's how you score that one. And then the asbestos type, which is straightforward, not subjective. Regarding excluding these are just the 6 commercially mined for or commercially used types. Again, chrysolite has sort of long been known as sort of more hazardous than the rest, so it gets a score of 3. Remaining amphibols 2, and chrysotile 1. So that gives you a score between 2 and 12. Typically at this point we sort of say anything plus 10 plus is a high risk, and these are just sort of suggested risk categories, but that's not the whole picture. So with the material score, you've got half of the picture, the rest is in situations. So seeing these photographs, these are sort of underscore ducts, so they're maybe friable insulation that's in school ducting, but typically it's out of the way and nobody's been exposed to it. So then we have to look at this priority situation. Obviously, if it was a similar situation in a classroom and you've got high potential of young people being exposed, and then, or for instance, in boiler rooms, which are something you can access quite easily, but only might be one person being exposed infrequently, maybe going into a boiler room once a week. So the priority risk assessment, you've got 4 areas: occupant activity, likelihood of disturbance, potential for human exposure, and maintenance activities. Each of those 4 are divided into subcategories. and this gets a little more complicated than just the material risk assessment, because we had to add up and then divide by the number of categories they're in. So occupancy activities is straightforward unless you've got sort of two levels of activity. But again, this is a likelihood of material being disturbed. So if it's in the sports hall and someone's likely to kick a football through it, then that's high level of it, high potential of disturbance, down to sort of little use storerooms. Likelihood of disturbance is subdivided into three. So I'd say we'll add up the 3 scores and then divide by 3 to give us the average. That's based on location, accessibility, and extent. So location, these are pretty straightforward. As I say, if you can download them, the documents, probably most of the countries have got similar sort of documents. You've got confined spaces, obviously, because whatever's the material is confined into, you're going to build up the concentrations more to being outside. Accessibility, again, is it routinely disturbed, occasionally or unlikely to be disturbed, and then the extent or amount, so gaskets, etc., get 0, and 50 meters or greater, or you use your sort of variation on these, meter squared or length of meter pipe or length of runs, etc. As I say, then you add up those 3 scores. So if you had a confined space that was routinely disturbed and had large amounts of asbestos in it, that would give you a score of 3. So to give you 9 and then divide by 3 to give 3. Human exposure, this is just the number of occupancies, the number of occupants, frequency, the use of the area, and then the average time the area is in use. Again, this is a times, add them up and then divide by 3 at the end. So if you've got greater than 10 occupancy, you get a score of 3. It's all fairly straightforward. If it's daily occupancy, so again, this is if it's a school classroom, would get a 3 again. And then it also get sort of greater than 6 hours. I mean, you might want to say that if it's school lessons and they're not in the same classroom all the time, then they might only have a score of 1 for 1 to 3 hours exposure. And then the final one is a maintenance activity. So this is going to be maintenance staff really, and whether that's a sort of once a month activity or rarely to be or unnecessary to be disturbed, and it's whether it's sort of a high level of disturbance, like moving a number of tiles to get access to a ceiling void, or just changing light bulbs. So then that gives us another score out of 12, which we add to the first score with the material score. It gives us a minor, we can't get less than 1, so it can't get 1, so that's an error in that slide. But 2 to 5 would be minor, 6 to 11 low, and again, you can use these scores to prioritize which materials you deal with first within your budgetary constraints. There's no official guidance. Some of them are subjective, so you're going to get different readings depending on who's looking at different scores depending on who's doing the assessment. It does give some useful information on where you prioritize spending your money. And it can but it's not, shouldn't be just as straightforward numbers. So you take that number and then because you could get a score of 12 just by fibre in an underscore duct, but nobody's going to be exposed to it. And then it can be used to demonstrate risk reduction. So this is if we're not going to go wholesale removal, but we do some mitigation measures such as re-encapsulating and so on. That can bring the risk down. And we can use that as an example that you've done some work to mitigate risks. So this presentation will be up on the website, and so you can access these. I think overseas you can, if you could press on those links, you can download those documents we talked about, and within those documents, but normally in the appendices, you'll be able to find the same scoring categories for the algorithms. Okay. Thank you very much.
thanks so much, Jason, for everything you do in the Workplace Health Without Borders in the UK, and also the working group with the asbestos working group with Alec as well. So if I can just, you can stop sharing, and then I'll just share my screen again. Thanks, Jason. So we're now up to Dr. Matthew Hayden Gurverka, all over to Australia, along the assessment of risk that you kind of alluded to, as talked about, Jason. But Matthew's actually going to be talking about using observation and a mobile phone app. So Matthew currently works at Cancer Council Western Australia, responsible for delivering Cancer Council's national occupational environmental cancer prevention project called No Workplace Cancer. Dr. Gurverka completed his PhD at Curtin University School of Population Health, researching asbestos exposure in a residential environment. So there's the risk to families and communities. His doctoral studies involved the development, validation, and implementation of a mobile phone app called ACM Check to be used as a screening tool to identify asbestos-containing materials in and around residential settings. Gabrielle Mizan, who's on our working group, actually told us about Matthew's work. So thank you to Gabrielle, and now I'm going to hand you over to Dr. Matthew Gurverka. Over to you, Matthew. Thank you.
Brilliant. So thank you. Hello, everyone, and thank you very much to Kevin for the introduction and the team at Workplace Health Without Borders for inviting me to present on my work that I undertook for my PhD. And this work involved the development, validation, implementation of a mobile phone app called ACM Check to be used as a screening tool to identify asbestos-containing materials in and around residential settings. So today I will provide a bit of an overview of the design and development of that app, and then a summary of the latest findings, as well as touch on some of the key takeaways from our experience assessing risk using a mobile phone app. So before I get stuck into things, in the spirit of deepening relationships, I'd like to acknowledge all the traditional custodians and owners of the country throughout Western Australia, so including the traditional owners of country from which I'm presenting on today, the WHWB people from the Noongar Nation, and recognise their continuing connection to land, waters and community. I also pay my respect to their elders and extend that respect to all Aboriginal peoples living and working in this area. I'd also like to take this time to acknowledge the very important contributions that all of these people and organisations have made throughout the lifespan of this project. As we have an international audience, I thought it would be a good idea just to provide a little bit of context relating to asbestos use in Australia. So Australia was the highest per capita consumer of asbestos-containing materials in the world during the mid-20th century, with asbestos cement industry accounting for about 90% of all consumption of asbestos fibres in Australia. These asbestos-containing materials were commonly used, or very commonly used, in residential settings between the mid-1940s and then the late 1980s. And asbestos was completely banned in all its forms in Australia in 2003. But because of our heavy use of asbestos in the past, Australia actually has one of the highest incidence rates of mesothelioma in the world. And Western Australia, where I'm based, has the highest incidence rates in Australia. So currently between 700 and 800 new cases of mesothelioma are diagnosed in Australia every year. So despite asbestos being phased out of use in residential settings in the late 1980s, an estimated 1 in 3 Australian homes still contain asbestos. And this means that there's a significantly large reservoir of asbestos in the Australian residential environment, where these materials present a health risk when they're damaged or disturbed, such as during do-it-yourself home renovations, maintenance activities, removal, or from natural disasters. Consequently, this asbestos legacy presents us with a number of challenges and unknowns in the residential sector. So firstly, homeowners and home improvers, or DIYers, do not have a good understanding of where asbestos-containing materials can be found in the home and then how they can protect themselves. This is compounded by the fact that there is a wide range of asbestos products that can be encountered anywhere inside and outside of homes built before 1990 in Australia. and that in situ asbestos in the residential environment is difficult to accurately identify without laboratory testing. Previous surveys have found that greater practical information and guidance is needed in the community on how to identify asbestos and then how to correctly manage those risks. And to help us understand and tackle this issue facing the residential sector, we need further data on the types of asbestos-containing materials remaining in the current housing stock, and then the condition that these materials are in. So to try and combat these challenges, when I was at Curtin University, we were approached by the WA Environmental Health Directorate to create an application for community members and environmental health officers, or EHOs, to use that could help identify asbestos in the community. And the smartphone app that we developed is called Asbestos Containing Material Check, or ACM Check for short. And the app serves two main purposes. Firstly, we wanted to provide a free, easy to use and accessible screening tool that community members could use to assess residential settings for potential in situ ACMs in order to, one, raise awareness, and then secondly, to hopefully prevent exposure from those materials. And secondly, we wanted to use the app as a data collection tool by allowing users to anonymously share any data with us so that we could try to map the type and condition of in situ asbestos remaining in the Australian residential environment. So the app was created by a multidisciplinary research and development team, included myself, occupational epidemiologists from Curtin University, scientific health officers and a toxicologist from the State Environmental Health Agency, and then a health promotion software development company. And then we also had further input and review from other organisations, including Cancer Council WA, where I'm based now, the Australian Government's Asbestos Safety and Eradication Agency, as well as a few key environmental consultants and local government environmental health officers from around Perth. So the basis of the app is a self-administered structured questionnaire that guides users through a step-by-step visual inspection of the inside and the outside of the home. The questionnaire is supplemented with easy to follow instructions and plenty of photos of ACMs. And a total of 14 different areas are inspected. So these are things like the external wall cladding, the eaves, the backing board to the electrical meter box, and then the fencing surrounding the property. Multiple choice questions are asked about the age of the house, the type of materials used, the key features of those materials, and the renovation history. So whether or not they've been replaced before or after 1990. And based on your answers, the materials are automatically designated a probability of containing asbestos. So either not applicable, unlikely, possible, or likely. Of course, the mere presence of ACMs in or around the home doesn't necessarily mean that individuals are being exposed to asbestos fibres or that they are at an increased risk of developing an asbestos-related disease. Therefore, for materials categorized as possible or likely ACM, the users are asked to rate the material's current condition and the likelihood of that material being disturbed in the near future. And the answers to those two questions are then used to give the material an overall rating or a priority level for action or remediation, which is based on a simplified risk matrix. Once you've completed the inspection, the app automatically generates a report showing a summary of your results and a table of general recommendations which correspond to those given priority levels. So here's the report for my house. And if we look at fencing, for example, you can see that it's considered likely ACM. It's rated as being in fair condition, with it unlikely to be disturbed in the near future. And then based on this, the fencing has been given an overall rating of very low priority. And then when we consult the recommendations table, we see that all I need to do is monitor the fence and that no immediate action is necessary. So all reports are saved within the app so that you can complete the questionnaire as many times as you wish. And these can also be exported or emailed as PDFs. Before we released the app to the Australian public, it was necessary to test its accuracy on a sample of Perth homes. So we conducted a validation study that aimed to evaluate the accuracy of the app in identifying in situ asbestos compared with on-site inspections conducted by an experienced environmental consultant. And then we also use this as an opportunity to assess the app's functionality based on feedback. So really briefly, we conducted a cross-sectional study that involved participants completing the app on their homes that were built before 1990 and located throughout metropolitan Perth, Western Australia. They then completed an online questionnaire on Qualtrics, so we could obtain feedback on the usability, the navigation, ease of use, and the length and flow of the app. And then, of course, the environmental consultant went out to each of the homes to conduct an on-site inspection, and they were blinded to the results obtained in the app. And then Cohen's kappa statistic was calculated to evaluate the strength of agreement between those two methods. So the 40 houses sampled were built between 1898 and 1988, median year of 1966. And overall, the study found that there was very strong agreement between the two methods when categorizing a home as positive or negative for having some form of ACM present anywhere on the property. And agreement between the two methods differed when categorizing specific materials as positive or negative for asbestos. So there was substantial agreement for things like fencing and outbuilding walls, backing board to electrical meter box. However, there was only fair agreement for things like outbuilding roofs and interior flooring. But although the app was developed and validated on a sample of WA homes, it can still be used in all other Australian jurisdictions. Once we went through all the feedback from the validation study and compiled the new photos, the app was finalized and then released to the Australian public in June 2017, made available through the App Store and Google Play. So the app's been downloaded over 7,200 times between June 2017 and May 2022. And we have received the results for a total of 3,281 inspections, of which about 30% were completed in Victoria, and about a quarter were completed in New South Wales, and 20% completed here in WA. So this just shows that although it was developed here in WA, it's had great uptake by users in other Australian jurisdictions. In terms of who's been using the app, community members make up 3/4 of total users, and the majority of houses screened have been separate houses built before 1985. Of those 3,280 odd houses inspected, 2,652, or about 81%, were considered to have at least one type of suspected ACM present anywhere on the property. And across these houses with asbestos, there were over 7,600 materials categorized as positive for asbestos. So categorized as either possible or likely ACM by the app, with over 2/3 of these located outside the home. So essentially this means that we found that if a home has asbestos, then it is likely to have multiple types of ACM present, with 3/4 of houses with suspected ACM present having 2 or more types of ACM, with the average number being about 2.9 or 3 different types of materials. Overall, the most common ACMs in the sample were flat asbestos cement sheeting used as the backing board to the electrical meter box, which was identified at around half of the homes, and flat asbestos cement sheeting used for the eaves, soffit lining, veranda ceilings, or the carport ceilings outside, which was identified at about 40% of homes. Based on the priority assessment, the majority of ACMs in this sample were assessed as being in good condition or fair condition at the moment. However, this means that about 17%, or nearly between 1 in 5 and 1 in 6 houses or materials, how potential ACMs were in poor or very poor condition. So it's important to note that ACMs are aging and have now been in place for a minimum of 40 years, upwards of 80+ years, which means many ACMs are potentially reaching the end of their lifespan, and their condition is likely to worsen. So to finish with, here are a few key takeaways from our experience relating to risk assessment using a mobile phone app. So our project shows that a specially designed mobile phone app can offer a free, easy to use and readily accessible approach to asbestos risk assessment in the residential environment. And if it's designed appropriately, it can be used by a range of community members, particularly those who are untrained or inexperienced. It can be dual purpose, so it can be used as a screening tool to increase people's awareness of asbestos in the residential environment, while also being used to collect data for public and environmental health research. And once you downloaded the app, we designed it in such a way so that you could still use it in areas with no or limited internet connection, which was really important from our aspect in WA with the large remote and regional population. So we reckon our approach is replicable and can be adapted for use in other countries where ACMs were or continue to be used in residential settings. Of course, the parameters and the questions would need to be updated to reflect the circumstances specific to the country. So different countries may have phased out asbestos in different years. They may have different regulations and prohibitions pertaining to asbestos use. They may have different profiles, types, or frequency of ACMs used in homes. Regardless, we reckon that ACM check offers a model that could be easily modified to accommodate these country-specific variables. Of course, it's important to acknowledge that this approach does have some limitations, and in particular, the data coming through ACM check doesn't show the whole picture of legacy asbestos in the residential environment. Part of the reason is that the app only accounts for a defined and limited set of ACMs. Although we attempted to capture the most common uses of it in the home, it doesn't include some of those rarest circumstances where asbestos may be encountered or when ACMs are hidden or not immediately visible. And as a result, there's definitely a continued need for on-the-ground assessments by industry experts who can conduct more thorough household inspections and collect samples of potential ACMs for confirmatory laboratory testing, which is currently the only way to truly identify asbestos. And technology is rapidly evolving. The technology landscape is vastly different to when we initiated this project in 2014. Our app is relatively simplistic in that it's a questionnaire-based guided inspection of the property, but it doesn't integrate any image capture or image sharing functions or use of cloud-based technology. And this can be viewed as a positive if you're looking to replicate it in other countries due to its relatively lower cost. And then lastly, collaboration is key. It's really important for public, environmental, and occupational health professionals to closely work with app developers and software developers so that we can use and adopt the latest technologies to provide the best possible products for the community and for the professionals as well, and also collect the best possible data. So thank you very much for listening, and I hope you found it useful. I won't be able to stick around for any Q&A, but please feel free to reach out via this email if you have any follow-up questions. So
thanks very much, Matt.
much.
I really appreciate your time. Just quickly before we move on to the next speaker, there was a comment about the applicability of this app to workplaces. Did you want to comment on that?
See, it's different. It's difficult because we specifically chose the residential environment because that's easier to define as a standard house. Asbestos can be encountered in quite a variety of different ways in occupational settings, in different industries and things like that. And it was it's a bit more of it's a difficult challenge. It's a different challenge to the residential environment. It could certainly be done, but it would require some work.
Okay, just quickly, then, is this available internationally or only in Australia?
It's limited to Australia, but I can have a chat to our app developer and see if we can release it for international downloads for a short period of time, if people would find that useful.
Fabulous. Thanks so much for your time. We really appreciate that. And great
No
work.
worries at all.
Congratulations on your PhD. Thanks. Bye.
Cheers, Kevin. Thank you.
So now the next speaker is Dr. Andrei Korchesky. He's going to be talking about an empirical model of mesothelioma and potence factors for different mineral fibers based on their chemical composition and dimensionality. So I'll just give you a quick update on Dr. Andrei Korchesky. He's a certified toxicologist, certified industrial hygienist, and the director of research and development at a C&IH Incorporated. He holds a PhD in applied mathematics, a doctorate in biology, and is a full member of the Society of Toxicology. He published numerous peer-reviewed papers in the fields of risk assessment and risk management, toxicology, and exposure assessment of fibrous minerals and nanoparticles, cancer epidemiology, mathematical modeling, and theory of numbers. He is a consultant of the American Conference of Governmental Industrial Hygienists, and Distinguished Lecturer of the AIHA. He organized and taught numerous classes on risk assessment for major conferences in the US internationally, including at AIHCE, BOHS, SRA, and others. Over to you, Dr. Kurczewski. Thank you so much.
Okay, thank you, Kevin. Thank you very much for the invitation and for the introduction. I'm trying to share my screen, right? Can you see my screen now?
Yes.
Oh, thank you very much. Once again, it's very interesting for me, and I hope you will see the value of this discussion today. What I'm going to talk about is quantitative health risk assessment for various types of elongate mineral particles. And I would like to start with a, let's say, practical example. Let's imagine this specific exposure scenario. So Mr. Smith was exposed to 0.1 fiber per cc of asbestos, and let's assume that it's an upper bound concentration and that it was measured by phase contrast microscopy or phase contrast microscopy equivalent. Let's assume that Mr. Smith was exposed during 20 years of working, and 0.1 is this cap of his exposure, and that he worked where he could work, mining industry, let's say. The exposure of Mr. Smith was 30% to chrysotile and 70% to fibrous tremolite. And the task that we would like to complete, to perform, is to estimate lifetime excess mesothelioma risk for Mr. Smith from his asbestos exposure. Why we need it? We all know that asbestos is carcinogenic, dangerous, and so on. First of all, we would like to understand what's going on with people working at the same mine as Mr. Smith, for example. And we would like to take actions. And for that, very often we need to determine what is the level of risk. And this is what's an issue for us. So two types of elongate mineral particles that Mr. Smith was exposed to. Chrysotile, chrysotyl, as some people say, could be both ways, chrysotyl and tremolite. And as you all probably know, in many countries, including the United States, there are 6 types of minerals that are treated and regulated as asbestos: chrysotile, chrysotyl, tremolite, antofillite, cracidolite, amosite, and actinolite. 6 types. For some of them, it's specifically stated in the definition that those fibers should be asbestos, asbestiform type. Because, for example, tremolite could exist in asbestiform and non-asbestiform variety. This statement is true for many of elongate mineral particles, like antofillite also can be asbestiform and non-asbestiform. Cracidolite, it can be commercial cracidolite or ribikite that is not asbestiform. However, what's even more important, in the current environment, as well as in scientific studies, we see emerging elongate mineral particles, not just 6 types of commercial asbestos. And I can list just some of them. And I am sure that many of you potentially encountered exposure of workers to some of those elongate particles, or maybe this exposure exists, but we don't know it fully. First example is erionite. Many of you heard about mesothelioma epidemics in Turkey. That happens in one of the regions where people were exposed to fibrous erionite based on the works of Wagner and some recent publications. Erionite potentially is one of the most dangerous types of elongate mineral particles, producing very, very high rate of cancer in laboratory animals and in humans observed in different situations. Fluoroadenite in Italy and in other regions. Famous silicate ballangeroite, it's also Italy, but people apparently see it in different regions as well. Glaucophane we see in the United States, but also in other countries, and there are outcrops of UK. Very famous example, mesothelioma mortality of workers in residence around Libby vermiculite mine in Montana, United States. People were exposed to Libby amphiboles there. It's another type of elongate mineral particles, significant part of which are asbestiform. There is Minnesotite. We suspect it to be asbestiform in some situations, but don't see it often. Some people state that all elongate mineral particles are the same. However, when you look at the mineralogical data and on epidemiological data, it's very convincing that there is difference between various types of elongate mineral particles in their propensity, ability to produce cancer. All of them potentially are carcinogenic because of the mechanisms, the type of the agent. However, what we see and know now, that there are those differences, and those three are only some of them that I put on this slide. Amphibole asbestos is more potent than chrysotyl, especially for mesothelioma production. I believe it's gradually stopping to be a controversy, because once again, chrysotyl is a carcinogen. There is no question about that. But the difference is significant, especially because of the mineralogical qualities of the fibers, of physical and chemical parameters of them. There is a difference. Second difference between various types of EMPs is that long, thin fibers are more dangerous than short, thick. So this is kind of a continuum transition from spherical particles without elongation to the situation when we have an elongate mineral particles, when the aspect ratio between length and width becoming greater. And so we observe a significant difference in effects. And then there are two habits, as I already mentioned. The same mineral composition can be for asbestiform and non-asbestiform variety. Hematite versus grunerite. Asbestiform actinolite versus non-asbestiform. And the difference in carcinogenicity is very pronounced as well. But how we know? What we know about numerous elongate mineral particles that are around, potentially around our communities, potentially at the workplaces. And it can be erionite, it can be fluoroadenite, it can be glaucophane. So what we do? So different epidemiological studies determine the so-called potency factors for various types of elongate mineral particles or fibers. And I put some values on this slide. Darnton from HSC, United Kingdom, just published new paper. It's paper from 2023 in the journal Environmental Research. It's new data about the carcinogenicity of various types of fibers. And I put here the so-called potency factors. You see, this one is for chrysotil. This is crocodylite, blue asbestos. This is amosite, brown asbestos, so-called commercial brown asbestos. And 3 varieties that are asbestiform. 2 observations. You see the difference in potency, quantitative difference in potency on mesothelioma between crocodylite, amosite, and chrysotil. Once again, it doesn't tell us that chrysotil is benign. Every elongate mineral particle is a potential hazard, and we need to remember it and control it well. Specifically, if it's asbestiform, not just chunks of materials. However, look, tremolite, anthophyllite, actinolite, we don't have epidemiological data that would be sufficient to directly determine the level of potency. So we need different methods to assess the risk. So we need to be able to quantify risks for unknown, emergent, or not well-studied types of elongate mineral particles. It's very important for practical purposes. How to estimate mesothelioma potency for other types of asbestos fibers? We attempted to use, I would call it artificial intelligence. In toxicology, it's called quantitative structure activity relationship modeling, or QSAR. But technically, it's when you use computers modeling approaches to find the parameters that actually play a role in the difference between various types of fibers. So you have fibers, and then how to explain that they're different. In 2018, 2019, we used the following method. We put different elements of chemical composition of various types of fibers. We also used very important parameter, aspect ratio. So it's a length divided by width of fibers. This is kind of the parameter of the elongation. And when we put all different parameters to the modeling tool, computer statistical tool, we then determined the parameters that would allow us to predict carcinogenicity of specific types of mineral fibers. And please look how the model turned out. So this is kind of the results of the modeling. So from all different parameters, it's selected several that would be the most predictive. And the parameters are silicon dioxide content of the fibers, iron 3+ content of the fibers, aspect ratio of the fibers, I mentioned several times. And then very interestingly, magnesium oxide is in the model with the negative sign, meaning that more magnesium, less potency of the fibers. And this is the paper we published in 2019 In the journal Inhalation Toxicology, you can find this paper if you're interested. So it's peer-reviewed paper 2019, Inhalation Toxicology, called Empirical Model of Mesothelioma Potency Factors for Different Mineral Fibers. This is the model. It's a little bit cumbersome looking at that from kind of mathematical point of view, but this shows what I just said. 4 parameters chosen, selected, not by us, but by the modeling tool, quantitative structure activity relationship modeling. And now you can see how well we're able to put different types of elongate mineral particles or fibers on the scale. And you see that this straight line is our model. Sorry. And the red dots are the values observed epidemiologically in the human studies. Chrysotyl, Libby-amphiboles, antophyllite, hemocyte. This is 2 types of crystallite, one from Australia, one from Africa. And this is Arianite. I mentioned you the epidemics in Turkey. So from Arianite to Chrysotyl, it's a scale. And we can look at that and we can see that correlation is very high. It's 0.998. It's very high statistical level of significance. And this is now the scale we can use. I would like to repeat, it's probably 4th time. Chrysotyl is here down below. It doesn't mean that it's not carcinogenic, but it shows that different fibers have different potency, propensity, carcinogenic quality to harm humans at different levels of exposure. This is from our paper, published and modeled mesothelioma potency factors. And you see how well technically our model works. Like South Africa hemocyte, 0.06 published value, and our model produced 0.065. And this is for them, for all of them, for all types of fibers. It shows us that we can use this model that appears to be very efficient in determining of the carcinogenic potency. We can use it for various types of fibers. This is a fluoroadenine, and now we can assign a value, mesothelioma potency, 0.2, let's say. Crystallite is 0.5, 0.51, for example. This is glaucosane. This is Bolivian crystallite, another type of crystallite, but highly rich in magnesium.
Excuse me, Dr. Korczewski, there's a lot of static, like there's a lot of echoing in the background. I'm just wondering if maybe you position yourself maybe a little bit further away from the microphone, we might hear you a bit more clearly. Thanks.
Okay, thank you. Sorry about that. It's better now or not?
Still, maybe if you just move yourself back a little bit, maybe there's a, just speak.
Or this way?
Yes, and yeah, that's better, I think. Thanks.
Okay, thank you. Sorry about that. It's my new laptop, so I'm not yet accustomed to what is it. Sorry. Yeah, and so and this is Arianite with 4.5, and it's highest among everything that we have observed in different epidemiological studies. Back one step. It's very interesting that our model detects different, pronouncedly different levels of potency for tremolite being fibrous or spaciform versus so-called cleavage fragments. Cleavage fragments are small pieces of material of probably the same mineralogical origin, but they're just chunks of material of the rock, very small and potentially elongate. However, cleavage fragments not having the same biological activity as true asbestiform fibers. And so this is the difference. We have point or two mesothelioma patency or tremolite. However, cleavage fragments shown less than 0.007 from the small.
Sorry, Dr. Kolczewski, there's still a lot of static. There's a lot of, it's very hard. There's interference. When you started presenting, it was quite clear, and for some reason, it doesn't seem.
And I don't know what's going on. Let me mute myself, and then.
And I'm just wondering, is it possible for you to wrap it up in about 5 minutes?
Sorry, can you
I'm
tell
just
me
wondering, will you be able to finish your presentation in about 5 minutes time at 8:30 here?
No, we will try. At least.
Okay, thanks.
Mm-hmm. So, and my apologies, I tried to even mute myself and now I'm mute. Okay, so based on that, we can determine the level of patency factors for various elongate mineral particles. In 2020, we published this paper, Inhalation Unit Risk of Asbestos, showing the useful and convenient tool allowing to calculate the risk based on the patency factors and the level of exposure. And from there, and from the empirical model developed in 2019, we can determine the patency factor for tremolite. Look at my presentation after I finish, because we don't have enough time to do it. We can come back now to the example of Mr. Smith. So this is an example of exposure to chrysotil and fibrous tremolite. And the question, what would be the lifetime excess mesothelioma risk for Mr. Smith? And here is the calculation. So what we do, we take the exposure of Mr. Smith, we multiply it by the fraction of specific type of fibers, and then there are some coefficients used in that you can explore. Look at my slides that I propose to distribute. And then we have 0.08 cases per 10,000 workers for chrysotil exposure. And for tremolite, we have 3.1 cases per 10,000. It gives us excess mesothelioma risk of Mr. Smith at the level of 3.2 per 10,000. From the position of risk acceptability, it's higher than the criteria established by NIOSH. NIOSH wants us to be 1 case per 10,000. So it's in this case, it's 3 cases per 10,000. At the same time, we can see that for chrysotil, we are much lower than NIOSH criteria, but we are significantly almost 3 times higher than the threshold for tremolite. That requires assessment, monitoring, protective measures, personal protective equipment, other steps, and we would understand what's going on. Very briefly, I wanted to point out the paper that we published with one of the leading mineralogists of our time, Dr. N. Wiley, in 2023. It's a review of the role of dimensions in the determination of patency factors for different mineral types of asbestos. Very important observations that fibers thinner than 0.25 microns generally potentially are those who produce mesothelioma in humans, reaching deeper, damaging the cells. And this is very, very, very important for us. So we can calculate the potency of tremolite, but we also need to remember the different sizes of fibers would also have different levels of potency for humans. And this is my conclusion that empirical modeling is an important tool to predict cancer risk in population. A risk assessment for asbestos fibers requires knowledge about relevant characteristics of the mineral, and mineral types of asbestos fibers can be scaled for their potency to produce mesothelioma. For example, as I said, erionite, crucidolite, amosite, balangeroid, libby-amphiboles, tremolite, glaucophane, and chrysotil. And from here, we can determine our steps to protect workers and community. Thank you.
Thanks so much for your time, Dr. Korczewski. Just a quick couple of comments. Really appreciate you donating your time and sharing all this great work with us. We had a conversation the other day that, there's different kinds of erionite. So the erionite in Turkey, for example, might have a higher potency factor than, say, erionite in other parts of the world. So, just when you say erionite, there are different types of erionite, and that was the conversation we had. The other comment I want to just make is that you talked about less than 0.25 microns. So we're kind of like going beyond the resolution of optical microscopy here, which kind of leads on to the speaker talking about an analysis. So we don't really have any time for questions, but I'm sure if people have any questions, they can reach out to you. And we just really appreciate your time. If you want to stick till the end, we may have time, but I'm not sure. But thanks again, Dr. Korczewski. Much appreciated.
Thank you very much.
Okay, if you don't mind, that's great. Thanks. So next presenter is Dr. Sharmin Shana. So we actually reached out to Asbestonomy. It's an international group of scientists, and we were asked, Dr. Sharmin Shana was identified as a really great speaker. So this really leads on from Dr. Korczewski's presentation. When we want to detect asbestos, measure it, what method do we use? So I want to bring you to Dr. Sharmin Shana through asbestonomy, but she's actually representing ITGA here. So Dr. Sharmin Shana is a research engineer at ITGA working on implementing artificial intelligence-based solution to transmission electron microscopy for automatic analysis and detection of asbestos fibers. Dr. Shana's work also encompasses development of high-through sampling solutions for transmission electron microscopy and scanning electron microscopy analysis. With a PhD in materials science, Dr. Sharmin has more than 6 years of working experience in academic and industrial research and development across the UK, Germany, and France. Dr. Shana's expertise lies in the domain of material characterization, notably using electron microscopy. Thank you very much, Dr. Shana. Over to you.
Okay, thank you very much, Kevin, for the introduction. So today I'm going to talk about how we can detect asbestos, so using different microscopic techniques, notably optical microscope, scanning electron, and transmission electron microscope, and how can we choose according to your case study. So I will start by giving the classification of fibers. The previous speaker has also mentioned and why it's important, and I will talk about it. So we all know the World Health Organization, or WHO fibers, which comprises of fibers of length of greater than 5 micrometers with a width of 0.2 to 3 micrometers, which accounts for actually 15% of the fiber distribution. And we might also have thin asbestos fiber and short asbestos fiber. So the thin fibers are basically, again, with the length of greater than 5 micrometers, but in terms of width, they're very, very fine, 0.01 micrometers, and they account for 17%. And then we also have the short fibers with a very fine diameter, as well as a very fine length. And that accounts for about 70% of it. In terms of carcinogenic properties, I mean, we might have health impact coming from all these 3 types of fibers. Now, how can we have a look at it? So usually, most of the countries we are used to optical microscope that uses electromagnetic wavelength in the visible range to be able to focus on the sample and then magnify it to be able to see the object of interest. But the optical microscope has its limit. Even after having the best quality lenses or mirrors, we are limited by physical property of the photons. So which is determined by the Abbe limit, and this is determined by the wavelength of the visible range. And finally, this allows us to have a look at objects that are limited to 200 nanometers or 0.2 micrometers. If we have an object finer than that or smaller than that, it's difficult to see it in the optical microscope. So that means that with the optical microscope, we will not be able to see the very thin fibers and the short fibers. So hence, we would need something which has lower wavelength to be able to pass the Abbe limit. So one way of doing that is to use either X-ray in this range or electron. So electrons, for example, will allow us to have very shorter wavelength, and thus improving the resolution down to 0.003 nanometers. This is nowadays it's easy to produce with high tension, and I mean we can easily manipulate it. But the problem with electron microscopes are we need a very stable vacuum system, and that's a problem because it means that it's a very expensive technique in terms of maintaining the equipment, in terms of electricity, also in terms of sample preparation, the amount of time it takes, the amount of preparation it takes to do the analysis. It's very time consuming and expensive. But to give a brief overview about the working principle, so this is what an electron microscope looks like. Typically, it can go bigger than that. So you have an electron source where you produce the electron beam, and then it is passed using condenser lens, objective lens through the sample, and using a projection lens, you project it on a fluorescent screen. So this is what our sample would look like under an electron microscope, and this is what the images would look like. So I think it's a picture of amphiballs. Now, in terms of preparation, so we typically take the sample. We prepare it on a grid of about 3 millimeters, and then we have to lock the grid in the sample holder, which goes directly in the vacuum sealed equipment. Now, this is where the part gets tricky because, again, this has to be done one by one, and it takes a huge amount of time. But and if we want to compare with the working principle of optical microscope and scanning electron microscope, so the principles are the same. Basically, we have a source of beam, either it can be light, photon, or electron, which passes through a condenser lens through the specimen and then projected either directly we can observe for an optical microscope, or on a screen for a TEM, Or in the case of an SEM, what we do basically, instead of transmitting through the sample, the beam is condensed in such a way to be able to make a probe out of it, and which raster scans on the sample, and we produce different types of signal which is detected by a detector, and then we are able to see the image on the monitor. So that's the difference between all these three techniques, and we have different resolution, again because of the type of the beam used. And just to compare what they look like, we have a silica crystal. Under optical microscope, you see that we are not able to see the differentiate the different facets, and it's not very, very clear. We are able to see, but not very clearly. Whereas on a SEM image, we see the surface very clearly. We can identify defects and so on. And using TEM, we can go down to see the atoms. Obviously, for asbestos, we don't need that. However, what is more important for the analysis of asbestos is to identify go beyond morphology. Because sometimes we might encounter samples which might not contain asbestos. In that case, we see fibers which we don't know what it is. Or sometimes we need to identify if it's a chrysotile or amphibole and so on. So an electron microscopy allows us to go beyond the understanding of morphology, which can be in the form of chemical composition or the crystalline structure. Because when we pass an electron through a sample, there are many interactions going on. And this is what we want. Depending on the chemical nature of the sample, we might have a characteristic X-ray emission, which we are able to see in using an energy dispersive spectroscopy. So for example, if we have a chrysotile which contains magnesium and silicon, we might have amosite with iron content or tremolite with calcium. So that's allowing us to differentiate between these different structures. Similarly, we are able to see in a transmission electron microscopy the crystalline nature of the fibers we are trying to analyze. So therefore, the electron microscopy gives us information beyond just the morphology. And in terms of TEM, what I can say, it's a very comprehensive technique which allows us to have a range of 0.1 nanometers resolution, chemical composition, as well as crystalline structure. Now, so I told you about optical microscope, what we are able to see. I told you about TEM now, and SEM. Now, if we want to compare the two techniques, say for example, let's take polarized light microscopy and compare it with TEM. So in terms of classification, both of them are able to classify and identify the crystalline nature. However, the problem is with PLM, we cannot quantify. And we are limited by the resolution. So therefore, we cannot see the smallest fibers, as Kevin has just mentioned. So in that case, we definitely need an electron microscopy to be able to see the TAF, the short fibers and the long thin fibers. Now moving on to phase contrast microscopy, which is another type of optical microscope. In this case, we can classify, we can quantify. However, the identification is a problem. It detects all types of fibers, but we are not sure whether it's asbestos or not. It can be another refractory fiber. The sample preparation is easy compared to, of course, TEM. For both of the cases, PCM and PLM, the sample preparation is super easy compared to TEM. However, there are these limitations in terms of the sizes, in terms of quantification, in terms of identification. Now comes the difference between SEM and TEM. These two are okay. It's very similar in terms of what we can do with them. The advantage for SEM is the sample preparation is easy, but the disadvantage still remains in terms of resolution, because we can go up to a minimum size of 100 nanometers. So if we have very, very thin fiber, it might be easier with a TEM compared to an SEM. And in terms of crystalline structure identification, TEM is the best choice because we cannot do electron diffraction or structural identification with SEM. However, in both cases, we can identify the chemical nature of the fibers we are trying to analyze. Now I will give you some examples of false positive and false negative. So here we have a sample of vinyl tiles. And so using a PLM, the result has been said that, okay, we don't actually detect any fibers. But the problem is if we take the same samples and put it in a TEM, we see a sort of carpet of chrysotile fibers. And mostly, thin asbestos fiber and short asbestos fiber in this case. Now, similarly, we have another fiber sample. In the PLM, we have identified unidentified mineral fibers. We don't know what it's made of. And then we realized with TEM that it's actually a variety of different fibers, including actinolite, anthracite, and tremolite. And now we also have an example of false positive. So in this case, it's an air sample. And in the PCM, so phase contrast microscopy, we say that we have identified a fiber. However, using TEM, we realized that it's actually not an asbestos. It's actually a refractory ceramic fiber. So you see, depending on what we are trying to look for, if it's a short and thin asbestos fiber, there's using a TEM or SEM would be the best option. However, of course, as I mentioned many times, that with the TEM, the problem being time-consuming analysis technique and expensive, optical microscopy is the easy solution. And for screening, for high throughput screening, that is the best solution that remains. And obviously, I mean, there's no right or wrong way to analyze. It has its own advantage and disadvantages, and each country has therefore put their own methodology out there and requirements in place. So in France, for the air sample, we use transmission electron microscopy. And I know for most of the European Union, countries in the European Union, they have their own methodologies. However, recently from the European Parliament, there has been a discussion regarding changing the regulations and potentially imposing electron microscopy for all the countries in the European Union. And also to potentially change the detection limit, which stays 0.1 fibers per liter now, but maybe decreasing down to 0.01 or 0.001. But that remains to be seen. Final remark is, I am based with a company called ITGA, and so we are mostly a French company. However, we have some collaborations in Canada and Australia. Today we are accredited in Australia by the NATA, which is the accreditation body in Australia. And with that, I would like to thank you for your attention. If you have any questions, please feel free.
Thanks very much, Dr. Shana. We might move on. I really appreciate your time, and you know, the information you provided is invaluable. Really, we need to understand the complexity and the methodology. So now I will hand you over to our next speaker, who is Dr. Stephen Mitchler. So I'll just quickly take you through. We're trying to catch up on time here. It's always the way when we have so many speakers. So Dr. Stephen Mitchler, he is with NIOSH, a senior research scientist with 23 years of project leadership and research in occupational public health, including the development of continuous personal dust monitor device currently being used in over 95% of underground coal mines in the US. A continuous diesel particulate monitor that reduces underground miner exposure and improved methods for elongate mineral particle monitoring and capture, which is the title of Dr. Mishler's talk. Dr. Mishler also has extensive experience in international and domestic public health leadership during the Centers for Disease Control and Prevention emergency response for COVID-19, Ebola, and polio in infection prevention and controls, surveillance, case management, occupational health, and vaccine distribution. Over to you, Dr. Mishler. Thank you very much.
Yeah, hello everybody, and thanks for the opportunity to discuss the NIOSH research. Just a quick familiarization. NIOSH is the National Institute for Occupational Health, Safety and Health in the United States, and we are a portion of the Centers for Disease Control and Department of Human Health and Services. And we do all of the occupational research for many different pollutants, but in the United States anyway. So today I'll be talking about developing new air monitoring and analysis methods for measuring occupational exposure to elongate mineral particles. So I'm going to kind of take this on a different path. I'll agree with most of the previous speakers or sort of talk along those same lines, but I'm really looking today at methods to actually collect these fibers rather than methods to analyze, although we will go through analysis a little bit later. The objective of our project, again, is here to create a new size segregated occupational sampler for elongate mineral particles. And also the second objective of this current project we're working on is to create a low-cost, real-time direct reading instrument for monitoring airborne EMPs. And I will go over both of these, both the work done in both of these areas. All of this research is based on the NIOSH roadmap for asbestos or for research on asbestos fibers and other elongate mineral particles. I don't know if everybody is familiar with this, but this is a really nice overview of some of the past research and what the future pathways could take in looking at EMP research. And again, we're really actualizing this roadmap here at NIOSH. So looking at size selective sampling for EMPs, the idea behind this came because, again, most countries, and I'm not sure all countries, but most countries are using the CAL sampling head in order to do occupational sampling for EMPs. The issue with the CAL sampling head is it's not really size segregated. I know a lot of work, or some work has been done saying that it's actually a thoracic size, but there's a lot of extra thoracic particles that can be captured for this same using this sampling head. And the issue with that is it creates a lot of confusion in the United States. So when you use this type of sampling and you send it to a laboratory, depending on the microscopist or whoever's doing the work, you can get two different types of answers. I mean, many people will call it a regulated fiber. And again, when I talk about regulated fibers, I'm really discussing the 6 commercial asbestos minerals that have been previously discussed, because that's what's regulated in the United States. But during the rest of this presentation and the sampling discussion, I will hope to expand on that. But again, we, does size selective sampling work for EMPs? And so in order to agree with this, we have to come up with dimensional characteristics, and Andre was sort of talking about that a little bit. T talked about it originally. If it looks like a duck or quacks like a duck, then it probably is a duck. So, we really need to establish what those characteristics are that we want to sample for. We need to establish the size range of concern, of course, create a sampling head then to match those criteria. And there has been some work that's saying maybe a width criteria of 1 micron would be something that would be applicable. But again, these are all things that are open for discussion now. And so we're still right at the beginning of this research and happy to gain input from any people, around the world that are actually looking and hoping to come up with something reasonably similar. The idea behind size selective sampling is for every other particle, that we use occupational sampling for, we have a size selective sampler. We have a respirable sampler. All of these started with total suspended particulates way back when. The CAL sampling head started being used in 1950. All of the other types of particulate sampling, we've adjusted through the years to use size segregated sampling. We've just never done that with asbestos or elongate mineral particles. So that's really the basis of this research. Essentially, what we're going to do is we're going to test a bunch of different sampling heads compared to the CAL sampler, just to make sure that we're not excluding particles that or fibers that need to be included in this, and we'll test many different sampling heads. Again, asking for collaboration. If anybody has an idea on what type of size selective sampler could be used, we'd be happy to work with you on this particular project. And then the idea would be, once we create a size sampling head properly, then we can do some toxicity work and show that the fibers that are collected using the cow sampler versus the fibers that are collected using the size selective sampler pretty much have the same toxicological effect or health effect, so that we won't really be, we can show that we're not excluding important health related fibers. Once we establish a proper sampling head, the idea would be that instead of the filter being clogged and totally covered with a bunch of particles that aren't really meaningful in the asbestos or the mesothelioma or cancer range fiber area, we'll have a filter that will essentially only have these types of fibers on it. So that would be, the ideal world. Probably won't work out that way, but at least we can move a lot more closely to having that type of work, and that would reduce any of the confusion that we currently see in the laboratories. Once we gain that filter with these fibers on it, the idea would be that we could use some type of electron microscope. I have scanning electron microscope, but I'll agree with the previous speaker that electron microscopy is the way to go here. And the nice thing about this is we can actually use, and we've started to do this, used automated particle analysis packages with the SEM. So we can put our filter, we can collect the sample on our filter, we can put our filter in the SEM, and then have the SEM automatically count the fibers. It'll give us a size distribution, length and width. And again, if we're only collecting fibers that are of a certain width, or we're able to size segregate that at the collection stage, then the analysis will become much, should be easier, and we should be able to use, there'd be less confusion with the electron microscopy. And this is the work we're doing currently. We capture these fibers on a filter, and we're comparing the information that we get from the scanning electron microscope versus or using AI technology with the information we collect just using the phase contrast microscopy, or having actually a person count each of those fibers. So that's really the work we're doing with this new occupational sampler. And again, I'm going quickly, but happy to talk with people more about this. The next area of research we're doing is this direct reading instrument for fibrous aerosols. There have been several of these. These are pictures of several, direct reading instruments that are or have been available, or at least work has been done on those. But the sampler we're looking at creating is electrical mobility. We have electrical mobility separator. The nice thing about using this for fibers is that fibers have the ability to collect much more charge than other spherical particles. And so we think we can charge these fibers and then use this electric mobility separator to only collect fibers. You can see here that the isometric particles, or the less fibrous particles, will be impacted sort of on the outer side of the filter, whereas the fibrous particles will move towards the center. If we turn this into, rather than a filter, if we turn this into a pathway, then we can actually then look at the fibers that are getting through that through the center of that area, and then we can count them just using any sort of optical particle counter. So this would be the idea that you could put on a worker. We could miniaturize it to put on a worker, and what we'd be counting is only the fibrous particles. So that would be the idea behind our direct reading instrument for fibrous aerosols. And again, these are all just beginning research. And now this is interesting work, the latest work, this EMP measurement with using the FTIR. We've been doing some of this idea and using the same filter that we would use. We'd collect fibers using the new occupational size segregated sampler. We would put all those fibers on a filter, and then the idea is that we can actually look at what minerals or what fibers are on that using an FTIR, and I'll show you some information. Currently, the work we've been doing just is potassium bromide crystals, so we haven't done filter work quite yet, but we've been able to pretty successfully separate all of the established the six asbestos commercial products, as well as their cleavage fragment or their non-asbestiform minerals. So, you can see that we can really separate the asbestiform and non-asbestiform amosite. We can separate the asbestiform and non-asbestiform actinolite. Any of these minerals, we've been very successful in separating using this FTIR technique. So if we have a new size segregated sample, we can put all these fibers on a filter. We can then directly put that filter right into an FTIR instrument, and then we can analyze that and be able to perfectly identify whether it's an asbestos fiber, whether it's a non-asbestos fiber, what the mineral is. And so we've had a really nice, we've had some pretty good success in actually doing that. We're using, again, this partial least squares discriminant analysis. And really what that does is it looks for small differences within the spectra for each of these minerals. And then it can actually, it can increase those differences to create a different, to show that we can actually differently analyze for different minerals. So finally, we've done this with some unknown mixed samples, and to the point that we've been reasonably successful in actually identifying the minerals in these unknowns. So at this point, our work has been reasonably successful, again, in being able to identify asbestiform versus non-asbestiform in different types of asbestos minerals on the filters that we've been collecting. So I know that's quick. I wanted to help catch up, but one other, our current work currently is just, again, using this is the system that we're currently using. We have asbestos in here in our little test tube. It's just, there's a shaker, and we can run it through different size selective samplers in order to capture it onto a filter. And then we can run that filter through the FTIR analysis. Once we get the spectra, we run that through the PCA and the PSLDA analysis in order to get the final result. So all of this work, again, is pretty much at the beginning, but initially things have been reasonably successful. This is going to be a 5-year project that we'll be working on. So we have a lot of time to continue and to optimize some of the work that's going on. And with that, I will, but of course, our NIOSH disclaimer that nothing I said here is supported by NIOSH. And thank you very much.
Thanks very much, Dr. Michler. What exciting work. You just have such fascinating research going on, and I'm sure many of us are very envious to look at this kind of work. And thanks so much for being considerate with your timing as well. And we've still got 3 speakers, and we haven't got a lot of time. And unfortunately, Alec, I'm going to have to leave you with little time to manage the rest of the webinar, but you're an old hand at this, so I'm sure you'll be fine. So the next speakers, we've got 3 actually. We've got Dorothy Cook, we've got Tuan Nguyen, and we've got George Keefe. So what I might do, Alec, is actually let you introduce the Dorothy and Tuan, and then I think Tuan's going to introduce George. So over to you. I can leave the slide up on the screen if you like, or I can take it down. It's up to you.
Thanks very much, Kevin. What a wonderful event. This is our 3rd webinar, and we've had such great attendance. I think today we surpassed 225 people from all over the world. That's exactly what we wanted to accomplish. So thank you, everybody. Thank you, Kevin, for the tremendous role you've played, and Tuan as well. So, and we can go a little bit past 9:30 for those able to stay. So we're still hoping to have some opportunity for discussion. So we're going to turn a little bit now toward practical frontline issues that are emerging or have been there for a long time. We'll start with Dorothy Cook, who's going to talk about contamination in talc. And of course, that's a very prominent issue right now, but often not thought about in the occupational setting. So it's more in the personal exposure setting with certain products. Then Tuan Nguyen, and Tuan's going to speak to the vital frontline issues that apply in many countries around the world. In this case, he's going to be focusing on asbestos, but as everyone will see, what we're facing there is the challenge of transition. And then Tuan, as mentioned, will introduce George, who's going to be dealing with a really crucial issue, which is what you do with asbestos in place that you just can't remediate, remove in essence right away. So very briefly, in terms of background for the two speakers that I'm introducing, real pleasure of this work is that we get to meet people from around the world, and I urge anyone on this call who wants to join our working group, please do so. I've posted my email address in the chat, and I'll do so again in a moment. Just get in touch, and we're meeting later in August to think about some other webinars that might be coming. Dorothy's been a tremendous contributor to our work. She's an occupational hygienist working in the UK. She has a master's degree in occupational hygiene. She's a member of the British Occupational Hygiene Society. She's done a whole lot of work around asbestos management plans in the UK, and is treasurer and secretary of our Workplace Health Without Borders chapter in the UK, and is a member of our working group. And then Tuan Nguyen, another tremendous pleasure meeting Tuan through this work. He's been over 30 years experience as an industrial hygiene and safety consultant. I won't go through his lengthy resume. It'll be in the one of the presentations that'll be distributed. But Tuan has led a tremendously important collaboration with Vietnamese colleagues. He co-founded the Vietnamese Industrial Hygiene Association. He's currently a member of their board of directors. He's also a member of IOHA, the International Occupational Health Association. And Tuan has put us in touch with the frontline challenges of the transition from using asbestos cement products in Vietnam to safer, much safer alternatives. So we'll start with Dorothy, and we are under some time pressure, so she'll hopefully squeeze her time a little bit. The same with Tuan. And then Tuan will introduce George, and hopefully we'll finish the presentations by 9:30. And then for those who can stay, we'll have some question and answer and discussion. So on to you, Dorothy.
Okay, welcome. Thank you very much. And very interesting presentations so far, and particularly, I think, the ones on the monitoring side, and a lot of those things about the different fibers hopefully will answer some of the questions. I noticed there was a question in the chat box previously, and hopefully when we get to that, we'll be able to answer it. Okay, so I'll begin, and I'll try to skate through this very quickly. It's really about talc and asbestos and talc, because in some forms of talc there is asbestos, and in other forms there isn't. So we'll just briefly introduce what talc is. Talc, or talcum, is a clay mineral composed of hydrated magnesium silicate, and that's the formula there. You have a magnesium silica oxide, hydroxide, and the crystalline form silicate is obviously the basis of asbestos fibers. Talc is used as a thickening agent and lubricant in many products, and it has the capability to absorb oils, odor, serves as a lubricant, and also as an astringent effect on the human skin. Where is it mined? In a number of countries, USA, Brazil China has a very high amount of it. And just going through the list of it, you can see it's all over the world, and other countries. Given that statistic there, I didn't have time to look at all the other countries. These are based on 2018 figures. So yes, its uses. In powdered form, it's often combined with cornstarch, used as a baby powder, foot powder, first aid powder, and in many cosmetics. It's also used in ceramics, paint, paper, roofing, plastics, rubber, insecticides, and other products. And it's widely used as an excipient that is combined with the drug substance or active pharmaceutical substance in the pharmaceutical industry. And it has these unique properties, being able to absorb moisture, also lubricate and flow easily. Now, according to some studies, talcum powder in cosmetics has been shown to contain asbestos fibers, not just asbestiform or non-asbestos fibers, but actual asbestos fibers. So as a result, US FDA can't guarantee that talc products are suitable for use in, that are suitable. Are they asbestos free? The American Academy of Pediatrics warned of this respiratory issue, which occurs in babies. Also, and I've got the link here, which you can look at later, talcum powder has been found to cause or associated with breast and ovarian cancer. Now, on the other hand, this talc paradox, talc in pharmaceuticals is asbestos free. It's been shown to contain no asbestos, and the reason for that is that it's very, very highly processed. The talc is very highly processed. I'll go into that in the next slide. So talc can be used in tablet formulations and as an excipient, and in topical and oral suspensions as well, quite safely. So it's derived from talc ores that are mined from deposits around the world. A large proportion of the talc is sourced in United States, China and India. The processing to remove the impurities is the important thing. So it's actually processed involving a form of crushing, grinding, milling the ore to a fine powder. Then it goes through a process of flotation, where the impurities are removed using water and chemicals, and the resulting talc powder is then sterilized because it needs to be for pharmaceuticals. But the important thing is that all these impurities, any likely asbestiforms are removed. So it's suitable for use in pharmaceuticals. Not only is it sterilized, but also the removed of asbestiforms. And here are some of the requirements. The US Pharmacopoeia and the European Pharmacopoeia require total absence of asbestos fibers. The methods that are used for testing, now these will vary. As was mentioned in a previous presentation, polarized light microscopy, but it's very important that they use the TEM method as well. It may well have been that they started off using the XRD methods and scanning electron microscopy, but then they dropped it with some laboratories and decided that they only needed to use polarized light microscopy, and possibly then, if necessary, use the TEM method. And that's important to explain that. I think there was a comment that SEM is perhaps less suitable because it may be that it doesn't actually show the fibers so easily, and so actually TEM is probably better. So the interesting point is that although the talc pharmaceutically may not contain asbestos, just bear in mind that talc is mined in areas where there may be asbestos, and also possibly, yes, there's likelihood of contamination, and that is the important point, that it needs to be totally purified. Just a point to note that, yes, there's the potential for contamination of talc with asbestos, so it's important to select talc mining sites that are free or away from asbestos mining. And it should be noted that there's no known link between the use of talc and cancer, but the risk arises if there's asbestos fibers contaminating the talc. So it's not the talc that causes the cancer, it's the asbestos fibers in the talc that are causing it to potentially carcinogenic. Okay, so what can we do about talc? How can we substitute or eliminate in the hierarchy of controls? Interestingly enough, that there was an article in the British Medical Journal in 2020, I think it was in 2022, but to declare that Johnson & Johnson will end the global sales of baby powder containing the mineral talc. They're switching over to a new formulation based on cornstarch. There's been a number of lawsuits, and that was the reason for it. As you can see, for over 40,000 lawsuits, alleging, that possibly the baby powder caused asbestos-related illnesses, including ovarian cancer, mesothelioma, or all sorts of possible cancers as a result. On the 9th of January 2023, the Netherlands submitted to European Chemical Agency a proposal for harmonized classification of talc. And so talc will be in future classified as carcinogenic category 2 in accordance with the globally harmonized system of classification. So what can we do about substitution of talc? Already there are on the market other forms which are substitutes for talc. So cornstarch blends, baking soda, tapioca starch, arrowroot starch, kaolin clay, rice starch, and oat flour. Should talc no longer be used in pharmaceutical products, even though it's actually very highly processed to ensure that it's free of asbestos? It possibly may be, it may be that cornstarch or rice starch could be good substitutes, but there are considerations that substituting a new excipient for talc may present changes in drug absorption time. The type of minerals present may affect, for example, in mineral supplements, that sort of thing. So, and it takes up to 10 to 15 years to change the formulation of a pharmaceutical product. I think this is usually more to do with the actual drug substance, but it could also apply to the excipient. So where talc is necessary in the formulation, my recommendation is that the mining sources of talc should be kept separate from all possible source of asbestos. Processing of talc for pharmaceuticals is done to very stringent requirements. There's a number of links which I have produced at the end of this presentation. So again, you can see, and I'll just skate through these slides quickly. So the conclusion are, continue to find substitutes for talc in cosmetics and other industries wherever practicable to do so. But where talc cannot be substituted, as is in the case of many pharmaceutical formulations, then it's necessary to ensure that the talc mining sites are selected carefully. Steps are taken to process the talc very carefully so that it's completely talc asbestos and asbestiform free. And there was a question in the chat box about, I think it mentioned talc fibers, but actually I think that question's already been answered in that there are other fibers which could be non-asbestiform fibers. But again, processing of talc for pharmaceuticals at least is such that there should be no fibers at all. And then here's the links. There's a lot of links there to go through, and I think that would be useful to, to follow up on. So thank you very much for listening. I hope I haven't overstepped the time-wise. And any comments to put in the chat box. So I'll stop the share now. Thank you.
Thanks very much, Dorothy. I'm going to have to ask Tuan and George to find a way, each of you, to do your presentation in 5 minutes. I think we've got to be done by 9:30. That's the scheduled time for the event. I'm very sorry about that. As you can see, with so many people with expertise, it's really tough to squeeze it all into the time. So let's get going. Dorothy, Tuan, and then George. And Tuan, you can introduce George, and then we'll have a question and discussion period from 9:30 to 9:45.
Hello, everybody, and good morning from California. My name is Tuan Nguyen, and I'm filling in for Mr. Đinh Xuân Ngôn. He's one of the industrial hygienists at the National Institute of Occupational and Environmental Health in Vietnam. Because of his traveling schedule, he could not be with us today, so I'm filling in for him. but my talk is a little bit different than what he's going to present. So mine will be on the challenges in controlling asbestos exposure in production and use of roofing sheet in Vietnam. Before I go into this statistic, I would like to mention that WHWB US, we have been working with Vietnam National University to develop an engineering program in occupational safety, health, and environment. The program going to start in late August, and right now we are going through the enrollment period, and I think we have a lot of people plan to attend that program. And to promote this new program, Vietnam National University planned to organize an international conference scheduled for late October 2023. So it's a way for them to reach out to the EHS professional throughout the world, and also to maybe collaborate for future projects. I have helped them to have a couple of MOU, one with the UCLA in Los Angeles, California, and one with Wollongong University in Australia, and there are a few more to come. So please support this conference by either become a sponsor, an exhibitor, or maybe an abstract reviewer. As soon as we know that we have the funding ready to go, we will announce the launch of it. So please participate. Thank you. And now I get back to my presentation. As you can see, over the years, after the initial announcement of the asbestos ban in Vietnam, slowly the amount of import of asbestos as well as the production are going down. You can see from 2015 to 2021, the chrysotype imported into Vietnam have been reduced, and it go the same with the production of the products that have asbestos containing material. This is one of the bag with white chrysotype from Russia, and they do list the hazard warning on their bag, and it also mentioned the danger is greater for smoker. So it's good that they have this type warning, but it's in English, so I don't think the Vietnamese people can read and understand that. This is one of the automated plan of roofing sheet production in Vietnam, because the weather in Vietnam is very hot. So you can see throughout the plant, there are the pedestal fan that placed around the production area, so to remove the heat. So if there are spill or asbestos dust in the air, it will be circulated throughout the plant. Here are some of the asbestos sheet ready to roll out for sale. I think they are go through the final process. After they are finished, about 80 or 85% of the asbestos product in Vietnam are used for roofing sheet, and most of them being used in the countryside, in the minority community, in the high mountainous areas where they have a lot of hurricane, tornado, that they need to replace their roof maybe more frequently. And also these materials are very cheap, so it's easier for them to afford to replace their home. Here is the interior of one of the house, and you can see the asbestos sheet are anchored into the building structure by the wire poking through the asbestos sheet. And you can also see that these things are ready to flake up anytime. So that will cause, maybe some exposure in the future. Asbestos fiber can get into our body through inhalation and also through ingestion, such as drinking the water or eating the food that has asbestos. I don't know how what is the hazardous ratio when people inhale or drink the fluid that contain asbestos. The roofing sheet production processes can generate a lot of asbestos dust during back tearing, crushing, wriggling, mixing, drilling, or cutting. And the community can also be exposed to asbestos dust when they dismantle the roof, smashing the roof sheet, or use the old sheet to build a road and pour in the foundation for residential construction. So before the ban become effective, safe and controlled use of asbestos must be followed. That's what been told by everybody in the industry by the Ministry of Construction, and also with different agencies as well.
So Tuan, we've got to wrap in about a minute so that you can introduce George and give him his opportunity.
Okay. Let me go through quickly. So here are some of the method to control the exposure. So you can do source exposure, engineer control, personal protective equipment, housekeeping, and also doing personal monitoring to ensure that people don't be overexposed. And here's some method that they use. They can either use Vietnam or international methodology. In 2022, the Ministry of Construction put out a proposal with some general goal talking about replacement of asbestos fiber and use safer alternative, ensure that the prices of roofing sheet are affordable for low-income areas, and reduce or stop using chrysotile in roofing sheet starting 2030. Vietnam have been delayed the asbestos ban from 2004 to 2010, and then to 2020, and now it's to 2030. And I hope that in the future they will be able to keep this 2030 date. And we were talking about the safe use of asbestos, but actually a lot of companies that involved with manufacturing asbestos are not really in compliance. Only a few companies install the closed loop production system, and a lot of companies are overexposed. For example, in 2009, you can only see 3 companies exceeded the PEL out of 156 samples. By 2021, 108 samples had asbestos fiber dust, and the average concentration was 0.19 plus or minus 0.14. So in theory, people can be exposed 3 times the PEL. This is the rough cost of the price of the asbestos sheet in Vietnam. The most expensive one is about 60,000 VND, which is equivalent to about $2.50 per sheet. When Vietnam keep complaining about it costs so much to switch to the non-asbestos roofing sheet, but in China, you can see the non-asbestos flat sheet have been increased 900%. That was 2018. But by 2023, I think that will be a couple thousand%. So they are moving away from using asbestos, but Vietnam still have not developed the products to replace that. So that's it. Thank you very much. And now I would like to introduce George Keefe. He's the CEO and founder of Global Encasement. an international pro-planet corporation that provide green coating solution for top building challenges such as roof restoration, weather, waterproofing, buildings, safe in place management, and solid hazardous material. He started out as a painting coating contractor. He had the California C33 license. After he expanded his skill into asbestos removal, securing a worker supervisor certification, he began increase his knowledge in project design certification for solid hazard material, including asbestos and lead-based paint. So now I would like to invite George to speak.
Thanks for having me on. And the biggest factor I find in dealing with asbestos issues is financial. And either companies, institutions, and individuals don't have the money or they're unwilling to spend it to do what's necessary. So I'm going to briefly talk about the three options dealing with asbestos. Do nothing and leave it alone. Second is fully remove and replace it. And the third is management in places, which that's where my expertise comes in. And although I was an asbestos removal contractor, and much of my experience in the industry comes into play here. I found many times companies and individuals choose to do the nothing method because they are unaware of the in-place management method, or sometimes they have heard bad things about the results due to the wrong methods and products used, or as I mentioned, there are financial reasons. Every situation is different and should be based on a case-by-case basis. In some cases, all three options can be used on the same project. Management in place is keeping the materials where they are, doing what they're originally designed and intended to do, covering them over to help prevent breakdown release into the surrounding environment. This can be accomplished with hard barrier enclosures and then mostly with coatings. Hard barrier enclosures are built around the surface, such as with plywood, sheetrock, or paneling. This is not easy to accomplish and often very expensive. This creates dead air space between the enclosure and the asbestos, stopping harmful release and exposure. Although the asbestos material can continue to delaminate, break down, and fall off from the surface, they're protected, being released into that dead air space. This is not always practical, although it has its place. Example would be floor-to-ceiling columns that are covered with asbestos spray on fireproofing and continually get banged into, as with like forklifts hitting them. Sometimes the solution is a combination of the coatings applied first and then hard barriers on the outside, which would be my recommendation. Okay, now in-place management with coatings known as encasement encapsulation. These are fluid-applied systems like paint with brush or roller or spray. These systems are usually fully adhered, sticking directly to the asbestos-containing material, which then can quickly stop any asbestos release. Since I operate worldwide and sometimes in locations that have no asbestos laws or regulations, and if they do, there's no enforcement, a lot of the people are still aware of the dangers of asbestos and try to stop it from being released. So people will do sometimes whatever it takes to get the job done. I've seen many different materials used for in-place management that cover a surface and can stop or minimize asbestos release. Sometimes people can be very creative and use whatever is available to them. I've seen everything from roofing tar and motor oil to duct tape used. Anything that will even temporarily seal a surface is in-place management, although sometimes not the best. The downside is sometimes it can make things worse, especially over time, if whatever is used is not made to last and is quickly breaking down and then becomes part of the problem. I don't judge anyone else for whatever they do to stop the asbestos exposure with simple in-place management. I'm here to just talk about the practical, most easiest way I recommend and what I've personally found to be effective for long-term and what obstacles we can overcome, including financial ones, to keep people safe. It can be much less expensive to management in place and realizing many of the same benefits of full-blown removal and replacement, which in many cases triggers indirect cost. And that's what we're here to discuss. How do we get more people protected for less money? Let's look at some of the indirect costs and can escalate the expense of an asbestos removal and replacement project. Generation of hazardous waste that has to be transported and stored in special hazardous material landfills that comes from asbestos removal. It's more expensive and there are less options of that space than with typical dumps. Also, there may be a lifetime loan ownership in the dump of a person or company who generates and stores that hazardous material, known as cradle to grave, womb to tomb liability. So technically, if the dump owner decides to move his dump, they may be able to send you a bill for that. Many building owners choose to keep their asbestos in the building under their control, and that is sometimes another reason why they choose in-place management. In certain areas, those asbestos material dumps are not locally owned and operated, and transportation fees for asbestos to a distant dump can become astronomical. I was personally involved in a project on Okinawa in Japan, where the solid hazardous waste asbestos was generated, had to be shipped off island. And since there were no solid hazardous material waste facilities on island, that skyrocketed the cost, which by the way was not factored into the initial cost of the removal and replacement project. So future projects, they want to do whatever they could to manage the solid hazardous materials in place and not generate that waste whenever possible. Another large indirect cost of asbestos removal and replacement is building downtime, relocation fees for people and contents while the invasive asbestos removal and replacement process takes place. Even more expensive is production loss during that building downtime, especially if that facility operates 24 hours a day, 7 days a week. These losses would typically be figured with a simple cost analysis before decisions are made as to what action should be taken. With simple in-place management, the right coatings you can avoid that downtime, saving tremendous amounts of money that can be better spent elsewhere is usually a big consideration. If you can save 50 to 75% with in-place management on direct cost over removal and replacement, makes good sense to seriously consider that option. I was personally involved in a project where it was going to be a cost of $125 million to remove and replace the asbestos, and only $7.5 million to encase it. That was 94% savings direct cost. On that same project, you'd be saving $117.5 million that were managed, quickly determined was better spent elsewhere. This is a very large project, but you get my point that the cost savings can quickly add up with safe in-place management. In a simple cost analysis, you may also look at cost of money over a period of time and how that would be elsewhere better invested until the building was unoccupied and ready to be demolished. Management in place and waiting for a building to be unoccupied, then dealing with the asbestos can be much less expensive than removing and replacing it when the building is occupied, again, incurring all the other indirect costs. Also, once a building is going to be demolished, there is no need for replacement material that would be typical, and another cost associated with asbestos removal of an occupied building. Okay, now let's look at my personal preferred qualities I want from the coatings I use and recommend to my clients for simple long-term, and when I say long-term, I mean at least a 20-year life cycle, in-place management of asbestos and other solid hazardous materials, along with overall building restoration, including roofs that also may sometimes contain asbestos. First, they need to be green, environmentally advanced, zero VOCs, or volatile organic compounds, no offensive odors, no ozone depleting substances, non-toxic, water-based for easy cleanup, biodegradable, sustainable for long-term use, both interior and exterior, renewable with simple recoat at the end of the service life cycle, so they cross-link bond with themselves. Class A fire rated, waterproof, breathable, so they don't trap moisture, allowing outgassing and moisture vapor to pass through them. Impact, abuse, chemical and UV, ultraviolet light resistant. They take a lot of wear and tear for long-term performance, such as on a roof. Extremely flexible with superior elongation. They must move with the surface they're covering. All surfaces move through expansion and contraction, heat and cold and vibration. Coatings have to move with the surface they're covering or they will crack out. Easy to use with simple application methods, brush, roller, spray, also that they don't adversely affect the fire rating of material they are covering and are compliant with all known fire codes. They cannot adversely affect any existing building or environmental codes. They have to be backed up with extensive testing by third-party, independent, accredited laboratories. They have to be easy applied, forming a waterproof, seamless, monolithic, continuous membrane, resulting in an extremely tough, durable, flexible, and renewable system. They can easily handle crossover issues into situations like waterproofing roofs that contain asbestos. This again is just me and what I use and recommend to my worldwide clients. The last thing I'd like to say is there is no law that says you have to remove asbestos. What is asked is that you provide fiber-free, dust-free, clean air for your building occupants, and you can quickly and safely realize that with in-place management with the right green coatings encasement. Okay, I hope all this information is helpful for you making decisions on how to best prevent asbestos exposure to workers, personnel, and individuals. Okay, that was record time.
Thank you, George. Thank you so much.
But
And I'm sorry that you encountered the
Thank
pressure of time. I'm hoping anyone who has to leave, please feel free to do so. We're well past our scheduled time. Do people think we could go for another 15 minutes? That will allow some questions. I know there's been a lot said that there'll be questions about. And could I ask perhaps, Marianne, could you handle this because you're able to recognize people, unmute them, and you can either ask your question in the chat or directly.
Okay, well, thank you very much. And thanks to all our presenters, and especially thank you to the Asbestos Working Group for organizing this. So if you want to ask a question verbally, I am going to allow people to unmute, but please don't unmute unless you're speaking. And if you want to raise your virtual hand, there's an app, there's an icon at the bottom. Sometimes you have to click the 3 dots and find reactions, and one of the options is raise hand. So please do that if you want to verbally ask a question, or you can ask a question in the chat. There have been a lot of things posted in the chat, so you may need to ask your question again so we will see it. So is there anybody who'd like to start off with asking a question? And I hope some of our speakers can stay on. I know some had to leave. But if anybody if any of your speakers can stay in case you get questions or you can answer them, that would be great. Any questions for anybody? Monona, please go ahead, unmute.
Yes, this is especially for Andre. I believe you said that all of the fibers that are of those dimensions can at least cause cancer, some of them more or less, depending on where they fit in your system of composition and size and shape and so on. My problem is unique, and I can't say too much because there's a non-disclosure agreement involved here, but my workers will be inhaling a significant amount of talc. It's an industrial talc. It has no asbestos under TEM, but it does have talc fibers, both the chunky sort of fibers and the long, thin ones from the electron micrograph. I want something from somebody who will say that those are not innocuous. So, because we have a union that has balls and we don't care what the regulations are. If that has a potential to cause cancer, we can stop this exposure.
Hi, Manana, thank you very much for your question. So elongate mineral particles are carcinogen for humans. There is, as I said, a scale, so difference between the potency, and it's caused by just natural reasons, not that we invented. Chrysotyl is quickly dissolving. Tremolite is staying for a long time. What's important for talc discussion is the difference between asbestiform and non-asbestiform types of asbestos. It's also not invented by somebody. Libby amphiboles, it's a mixture of asbestiform and non-asbestiform types of fibers. This is why Libby is lower by potency compared to the commercial types of asbestos like gracidolite. So this is something that we can argue and have literature on our side to state what's going on. If you talk about talc 100% contaminated only with non-asbestiform fibers, it's all will depend on the exposure level and the probability that some asbestiform fibers will still be there. However, if you have a confirmed presence of asbestiform fibers there, if you know the exposure level, you can estimate the risk. And from here, you can say, okay, this is what the workers will be affected with. I would be careful in stating, yes, I said that all of them are carcinogenic. If they're asbestiform, I would qualify this wording more exactly. The question is, carcinogens are all around us. And so the question about the risk acceptability is not just a political issue. It's just something also very scientific and very natural. And so you can potentially calculate the risk for workers and to say, okay, we're exceeding all standards, all risk acceptability levels, and so on. And so it would be powerful argument on your side in any situation. If you are a scientist, if you are a union, if you're whomever, you need to have science on your side. And so for that, you need to know the contaminant, you need to know the habits of asbestiform versus non-asbestiform, and you can calculate the risk and say what is that. And if you need help with that, please ask me. My mail is probably available. Send me a message and then we can continue talking. And I hope I'm clear enough. It's not an easy issue, but there is a straightforward way to understand what we're dealing with.
Thank you. That helps a great deal. I do expert witness in talc cases, but I did not know that there was that much potential for actual talc fibers, not asbestos fibers, but talc fibers. So it came as a shock to me.
No,
thank you so much. Thank you so much, Andre and Monona. That's wonderful. Really appreciate that. There are some other questions, so I just wanted to mention them.
Sorry about that.
There is, oh no, don't worry. And you can probably, if you need to get put in touch with each other after this, we can do that. If you
I see my
yeah, okay.
mail.
There's a question in the chat. Is there a specific type of paint for encapsulation of asbestos, or do you just use a normal industrial type of paint? I assume, George, this is for you. If you can unmute, George.
Okay. Yeah, so, and just all the qualities I mentioned, you know, really important, making sure that it's long-term, that it'll last at least 20 years. Exterior on a roof, because if it lasts exterior on a roof, we know it's going to hold up, you know, on the interior of a building somewhere. And usually that can be indefinitely, because on the inside of a building, you don't have the same things attacking it, UV weatherization, as you do on the outside. So There are products out there, and if you want, you can contact me directly, and I'll point you in the right direction for that.
Great, thanks, George. You want to put your email in the chat so people know how to contact you? That's great. Thanks so much.
Okay.
Tuan, you have your hand up. Please unmute.
Mute. She's muted.
Okay.
Go ahead.
Can you hear me now?
Yes, we can.
Yeah, this is the question for, I think, Shami. Shana. Shana, is she still there?
Sorry, I can't see the participants right now. I'll have to look.
Oh, okay. All right.
Well, why don't you ask your question, and then if
I would
maybe
like to know the difference in cost between all the techniques of looking at the fibers from PLM, PCM up to TEM, and we know that it's important to use the most expensive method to look at asbestos fiber, but what is the difference in cost?
Okay,
and,
so Sharma is not here any longer. Yeah. Is there anybody else here who can comment on Tuan's question?
Yeah, this is Steve Mishler from NIOSH. Yeah. It is a substantial difference in cost. So getting a TEM analysis of a sample would be substantially higher cost than getting a standard PCM analysis, if that answers your question.
Yeah, during if people go to court, should they use TEM for their sample or to verify the sample?
I mean, no. I think using the best technology available, TEM certainly is able to, identify what specific fibers that you're talking about, especially if they're thinner and smaller fibers than the established laboratory. There's also a lot of confusion in the established laboratories with the microscopists, whether or not it's an asbestiform fiber. It really depends on what country you're talking about, because I think different things are regulated in different ways. But in the US, certainly, and Andre may actually have a little more information on that too.
Yeah. No, I only have practical kind of view on all of that. All standards, asbestos standards, all risk assessment methods are established based on phase contrast microscopy. The standard of 0.1 fiber per cc in the United States is PCM. Steve, absolutely correct that without TEM, we don't know what type of fibers we see. So it's a combination of two methods: PCM for the levels, and then TEM is a supplement that helps us to understand the context, fiber type, and it's correct potentially to expand the size distribution of fibers we see, because it remains to be controversial, especially for chrysotype, what width we actually can see by PCM. Today we heard, by the way, that 0.2, it's a physical limitation, so it's a wavelength question. And by the way, I also wanted to ask this question. Many people say that amphibole fibers are seen down to the width of 0.06 microns. So it's a little bit controversy in the physics. So we need to figure it out. But I'm sure Mr. Mishler will be able to do it with a new program on NIOSH. It's kind of very exciting.
Yeah, thank you very much. Thank you.
Just if I could just add something, I think it's really important to characterize exposures initially. So, electron microscopy is a great way to kind of get a good feel for the sizes of the particles once you've got a good characterization, then maybe you can just introduce optical microscopy. But just a note that there are limitations with the NIOSH methods 7400 and 7402. You know, I think 7402, basically what you do is try and confirm that the particles that you see under an optical microscope are asbestos. So people need to be aware of that particles less than 0.25 are concerning, and we need to understand what the exposure profile is for those particles. Thanks.
Yeah. Thank you.
Hey, Kevin, I don't see more questions here, and it is coming to the top of the hour, so half an hour later than we thought.
Yeah. Can I ask another question to Andre?
Oh, okay. Yeah, go ahead. We'll make
Okay.
this the last question. Okay.
All
go
right.
ahead.
Okay. Earlier you mentioned that NIOSH not recommend, but would like to see 1 cancer cases per 10,000 occurrence. Is that correct?
That's true. It's what's
Yeah.
called risk management limit.
Okay, risk
And
management.
Maybe know more about that, but
Yeah.
it's a kind of policy of NIOSH. Remember that they wanted for the upper bound 95th percentile of exposure, not
Okay.
average.
Okay.
Maximum exposure should not exceed 1 case per 10,000 per lifetime.
Okay. So my question is, why asbestos? What was it? Is that 1 per or 3 per 10,000?
No, it depends on the exposure level. There is no universal answer, right? For my example with Mr. Smith, it was 3 cases per 10,000 per lifetime, but it's just specific example. So it was an example with 0.1 fiber per cc with current occupational exposure limit.
Okay.
Yeah, but okay. And also 1 per 10,000, it's it depends. It's nice to have a criteria. However, you may use different risk acceptability approaches and criteria to determine what's your purpose of the risk assessment.
I see.
So
Okay.
sorry to interject here. A number of us have work commitments. We've kind of stayed over half an hour. We need to get back to our jobs. So I'm just wondering if we could wrap up now. Thanks, Tuan and Alec and everybody from the Asbestos Working Group. And I just want to thank all the speakers and Marianne for being behind the scenes and helping stitch this together, and everyone else that contributed. I just want to say thanks again. And yeah, what a great turnout. And for people that stayed half an hour longer. So great information shared. Wonderful. Thanks, everyone. And any other final words, Alec, from you spearheading that? And Jennifer, who's our president.
Okay.
No, thank you. Fantastic. I always learn so much. That's all I'm going to say. You guys did a great job. I see some applause in hands, and there's still over 100 people logged in after, quite a long time. I think that really shows the level of interest and expertise. So thanks, everyone.